Anti-inflammatory vision diet for the holidays. Inflammation is a factor in many eye diseases, and what you eat affects inflammation. Whenever major holidays comes along, we are tempted to eat special foods. Many of these treats are high in calories and sugar, which contribute to inflammation. While you don't want to spoil anyone's fun, you can choose to eat foods that are anti-inflammatory. At the end of this video, you will find tips for limiting the damage while still enjoying the holiday. The dangers of inflammation. Inflammation can be acute or chronic. Acute inflammation occurs when, for example, you sprain your wrist. The joint becomes swollen, red, and painful. This type of inflammation is part of the healing process. The body is trying to remove damaged cells, debris, toxins and pathogens from the injured area. Chronic inflammation affects the entire body at the cellular level. This results in abnormal electrical activity that hampers cellular performance and causes oxidative damage. Inflammation and the resulting oxidative damage are implicated in many diseases, ranging from hardening of the arteries to eye diseases such as cataracts, uveitis, inflammatory glaucoma, and wet macular degeneration. Chronic inflammation is detectable using blood tests. C-reactive protein or CRP measures a protein that indicates the inflammatory response. CRP should be below 1 or, ideally, 0. A high fasting blood insulin level may indicate chronic inflammation. Risk factors for chronic, systemic inflammation include smoking, overweight or obesity, lack of exercise, sleep disorders, age, middle-aged and older, low sex hormones, excessive alcohol consumption, poor eating habits, fatty meats, white flour, and sugary foods instead of fruits, lean protein, whole grains, and vegetables. Measurable indicators of a higher risk of chronic inflammation include high blood pressure, high LDL, bad cholesterol, C-reactive protein greater than 1, high fasting blood insulin level. Many eye diseases are linked to chronic, systemic inflammation, poor circulation, and insufficient nutrients reaching the eye. Inflammation, heart disease, and retinal vein occlusion. Heart disease creeps up on people as they age. Younger people who are obese can also start to show the signs of heart disease. Regular doctor visits, family history, blood pressure measurements, and blood tests will reveal warning signs. You should never ignore these signs. Heart disease is the cause of 1/3 of deaths in the United States. Lifestyle changes are crucial to reducing the risk of heart disease, and even reversing it in some cases. Regular exercise, avoiding smoking, reducing alcohol, and eating a nutritious diet are crucial. The doctor may prescribe medication that should be taken as directed. The risk factors for hardening of the arteries are almost the same as for chronic inflammation. Researchers are closely studying the causes of chronic inflammation and how to control it. Controlling chronic inflammation could be key to longevity and a full life as we age. Atherosclerosis is also called hardening of the arteries. It is the buildup of plaque in the arteries. The plaque, made partially from cholesterol, hardens and causes the arteries to narrow. Organs become starved for oxygen, leading to stroke, coronary heart disease, chronic kidney disease and more. Retinal vein occlusion is when atherosclerosis affects the eyes. The veins that drain blood from the eye become blocked. The system develops a hemorrhage, damaging the retina. Vision loss is sudden and can be permanent. Any sudden changes in vision need immediate medical attention. Uveitis, eye inflammation. Uveitis refers to a group of inflammatory eye conditions. Often, the diagnosis includes a modifier such as anterior, posterior, intermediate, phonovitis, infectious, non-infectious, etc. Uveitis mostly affects adults aged 20 to 50. The uvea is composed of the choroid, ciliary body, and iris. Inflammation in any part of the uvea can damage the retina, lens, vitreous and optic nerve, leading to vision loss. Symptoms include sudden blurring, floaters, eye redness or pain, and photophobia. Causes include an autoimmune response, inflammatory disease, infections, tumors, bruises, and toxins that enter the eye. Treatments include anti-inflammatory medication and addressing any underlying diseases. The list of diseases associated with uveitis is lengthy. It includes rheumatoid arthritis, reactive arthritis, and multiple sclerosis. Uveitis can lead to cataracts, elevated intraocular pressure, glaucoma, clouding of the cornea, retinal swelling, and retinal detachment. Since uveitis has so many potential causes, maintaining a healthy lifestyle is the first line of defense. Inflammatory glaucoma. Around 1 in 5 patients with uveitis develop inflammatory glaucoma. As a result of the anterior uvea swelling, the trabecular meshwork becomes clogged. This may be reversible or chronic. Optic neuritis. Inflamed optic nerve. The optic nerve sends electrical impulses from the eyes to the brain. When the optic nerve is inflamed, vision becomes blurred. Optic neuritis is sometimes the first symptom of multiple sclerosis. Autoimmune disorders such as rheumatoid arthritis are linked to optic neuritis. Diabetics are also susceptible to optic neuritis. Pain behind the eyes when moving the eyes is the most common symptom, but there are many other signs of optic neuritis. Other symptoms include tender, sore eyes, enlarged central blind spot or mild to severe reduction in vision, blurred vision, decreased peripheral vision and/or color perception, headache, fever, and possibly nausea. Type 2 diabetes can usually be avoided or controlled by maintaining a doctor-recommended weight, exercising regularly and eating right. Blepharitis, lid inflammation. When the eyelid feels swollen, itchy, irritated, or crusty, the diagnosis may be blepharitis. Other symptoms include redness and blurred vision. This acute inflammation has several causes. The condition can occur along with styes and Schillerians. A skilled eye doctor can diagnose as blepharitis. Good lid hygiene helps treat and prevent blepharitis. Thus, people who are prone to this problem should clean their eyes daily using baby shampoo. See our video about baby shampoo cleaning. Inflammation and cataracts. Cataracts is the clouding of the eye's lens. Many seniors elect to have the lens with the cataract replaced by an artificial lens. A study linked inflammation and oxidization with cataracts. They compared biomarkers of inflammation against women with and without cataracts. Those with cataracts had higher indicators of inflammation. Arthritis and inflammatory eye disease. Connective tissue diseases such as arthritis can affect the eyes. Depending on the primary disease, patients may be more at risk of retinal detachment, keratoconus, or uveitis. Rheumatoid arthritis is linked to corneal melt, scleritis, and scleromalacia perforans. Holiday food tips. Eating, drinking and being merry for a couple of days a year makes little difference to your health. So long as you do not indulge in a blackout drinking or eating of unhealthy food binge, enjoy. The daily habits are more important. The problem is that for many people, the holidays run continuously for 5 weeks. The constant presence of extra sweets and rich foods can do damage. Excess sugar and fat lead aggravate chronic inflammation. Typical weight gain during the holidays is 1 pound. However, this pound is usually not shed later. Thus, after 15 years, that's 15 extra pounds. Anti-inflammatory tips. Fill up on raw vegetable sticks before tucking into higher calorie foods. Frequent snacking adds up. Eat at meal times. If you are obligated to snack, limit it to a few bites. Avoid vegetables drenched in cream, oils, and sugar. Opt for steamed vegetables instead. Anything surrounded by pastry is high in fat and calories. Thus, just taste one or skip it. Pecan pie has almost twice as many calories as pumpkin pie, and far more sugar. Discreetly look up the nutrient content on your phone once you know the menu. Restrict yourself to just 1 serving of dessert, or 2 small servings. Look for anti-inflammatory foods like leafy green vegetables, nuts, olive oil, fatty fish, fruits and tomatoes. Never overeat. Slideshow, top tips for healthier eyes. Take a 20-second computer break. Staring at a computer, or any digital screen, won't hurt your eyes, but it can make them feel tired and dry. Surprisingly, we blink about half as often when we're looking at a screen. Follow the 20/20/20 rule. Every 20 minutes, look at least 20 feet away for at least 20 seconds. Also, place your screen so it's about 25 inches away and slightly below eye level. Cut glare by moving light sources or using a screen filter. Always wear sunglasses. UV radiation can hurt your eyes just like it does your skin. Effects add up and can cause problems like cataracts, cornea burns, and even cancer of the eyelid. Whenever you're outside, even on cloudy days, wear sunglasses or contacts that block 99% to 100% of UVA and UVB rays. Protective lenses don't have to be expensive, just check the label. Hats block exposure to snow, water, sand, and concrete all can reflect UV rays. Use safety glasses at work and play. Nearly half of all eye injuries happen at home, not on a job site. Use safety glasses whenever a project might send debris flying or splash hazardous chemicals. Protective eyewear may prevent 90% of sports-related eye injuries. Lenses should be made of polycarbonate plastic, which is 10 times more impact-resistant than other materials. Some sports with the most injuries are baseball/softball, racket sports, lacrosse, and basketball. Eat for your heart and your eyes. Foods that help circulation are good for your heart, eyes, and vision. Choose hard healthy foods like citrus fruits, dark leafy greens, and whole grains. Foods rich in zinc, beans, peas, peanuts, oysters, lean red meat, and poultry can help eyes resist light damage. And carrots do help eyesight. The vitamin A in them is important for good vision. Other nutrients that help eyes include beta-carotene, found in many yellow or orange fruits and veggies, and lutein and zeaxanthin, found in leafy greens and colorful produce. Don't ignore eye problems. If your eyes are itchy or red, soothe them with cold compresses, antihistamines, or eye drops. If you feel grittiness, like the sand in your eye, rinse with clean water or saline. See a doctor if symptoms continue, or if you have eye pain, secretions, swelling, or sensitivity to light. Other reasons to see a doctor: dark floating spots, flashes of light, or any time you can't see normally. Clean your contact lenses. Take care of your eyes by taking care of your contacts. Always wash your hands before handling lenses. Use only cleaners and drops approved by your eye doctor. Clean, rinse, and dry the case each time you remove the lenses, and replace it every 2 to 3 months. Don't wear lenses when you're swimming or using cleaning products like bleach. Don't leave daily wear lenses in while you sleep, even for a nap. And don't wear lenses longer than recommended. Know your health history. Many seemingly unrelated health conditions can affect your eyes. High blood pressure and diabetes can reduce blood flow to the eyes. Immune system disorders in the lungs, thyroid glands, or elsewhere can inflame eyes, too. Other threats include multiple sclerosis, aneurysms, and cancer. Tell your eye doctor about any current or past health issues, including family members with eye problems or serious illnesses. Read drug labels. Many types of drugs, or combinations of drugs, can affect your vision. Be on the lookout for possible side effects from various medications used to treat different conditions. Tell your doctor if you notice issues like dry or watery eyes, double vision, light sensitivity, puffy or droopy eyelids, and blurred vision. Throw away old eye makeup. Bacteria grow easily in liquid or creamy eye makeup. Throw out products after 3 months. If you develop an infection, immediately get rid of all your eye makeup and see a doctor. If you tend to have allergic reactions, try only one new product at a time. Never share cosmetics and don't use store samples. Clean your face thoroughly before and after using makeup, and don't apply cosmetics inside lash lines. Get regular eye exams. You should get your eyes checked regularly, even if you don't wear glasses. Ask your doctor how often. It will be at least every other year from ages 18 to 60, or every year if you're older, wear contact lenses, or have risk factors like diabetes, high blood pressure, or a family history of eye disease. Stop smoking. If you smoke, stop. Smoking means a dramatic increase in incidence of macular degeneration as well as raising your risk of developing cataracts and aggravating uncomfortable dry eyes. It also builds up plaque in your bloodstream and weakens arteries. This not only raises your risk of a heart attack, but it can damage the retina and cause vision loss. The good news is that after you quit, your risk of eye disease is about the same as for non-smokers.